Okay, great. So our first question is, how did you get started in medical cannabis?
In 2014, February to be exact, John Morgan, one of our local attorneys that was promoting and funding the campaign for Amendment 2, which was the decriminalization of medical cannabis, started advertising on regular mainstream media. And I saw the commercials, and so I sent him an email and said, I'm a physician, I'm an advocate, how do I get involved? 24 hours later, I was speaking with his campaign manager. A week later, I was on his bureau of speakers, and pretty much the rest was history. I began to speak on behalf of medical cannabis, the decriminalization of it, participated in many roundtables, interviews, debates with different sheriffs from different counties that I was living in. And in 2014, when we went before the ballot, we didn't pass. It didn't pass by less than 2 percentage points. And so we had to wait until 2016 for it to go back to the ballot. But in the meantime, it allowed for the law to kind of find its place in the state of Florida. It allowed me time to study and learn more from people that have been doing it much longer than I had. And so it served multiple purposes. We already had laws in the state of Florida. We had Senate Bill 1030, which was the Compassionate Care Act that was signed into law June of 2014. And then in June of 2016, we had the Right to Try Act that dovetailed onto Senate Bill 1030, but we had no product available. And so, we had laws on the books, but we had nothing to give our patients. And it wasn't until August of 2016 that I was the first in the greater Central Florida area to recommend medical cannabis to an adult, a 35-year-old with a stage 3 brain tumor who is still alive. And then in November of 2016, I was the first in the state to recommend medical cannabis to a child, a 15-year-old with a stage 4 head and neck tumor.
So I think one of the things is like, asking about kind of the overview of medical cannabis, how it works, the treatment opportunities. I think we talk about how cannabis can be part of medical treatment, but I don't think the average person knows how to kind of even start to sort of get involved or find out. It always seems to be kind of the last measure and not sort of part of the treatment itself.
Right. Well, originally that Senate Bill 1030, we were allowed, because we only had 4 diagnoses available to us. Now things have changed, but we only had 4 diagnoses, which were epilepsy, chronic conditions that cause seizures, chronic conditions that cause muscle spasms, and cancer. That was it. And for the epilepsy or the chronic conditions that cause seizures, they had to have exhausted multiple anti-epileptic drugs before we would be able to recommend medical cannabis. And to this day, it still is that way, where they prefer for the child, typically, to use 3 or 4 anti-epileptic drugs, fail on all of them, and then consider it. And in the state, we have to have 2 physicians sign off on a pediatric patient. So we need 2 doctors to say that this child would benefit from the use of medical cannabis. And so that, again, poses a challenge, because a lot of neurologists, a lot of pediatricians, a lot of hematologists, oncologists that are managing these children, unless they have either worked with me or have researched or read something, are totally against the use of anything cannabis related, not understanding that those children have an endocannabinoid system that requires cannabis. And because they're so stressed because of all the stuff that's going on in their body, they need the exogenous or cannabinoids from the outside of the body to work inside their body to support and replenish their endocannabinoid system.
And one of the things I thought was interesting when I went to your website was you talk about Alzheimer's disease and how cannabis, and I don't see that much out there. Could you explain a little bit more about that?
Sure. In fact, I have a lecture that I've prepared and I have given And there's an actual product that has been created and approved by the FDA for clinical trials. It's called Hyalalex, which is a combination of cannabis, turmeric, and melatonin. And that combination is being used in the island of Puerto Rico, hence the flag.
Yeah, I noticed that.
Because we're doing clinical trials in Puerto Rico utilizing this product specifically for patients with Alzheimer's disease, because studies have been done on, obviously, animal studies showing that their cognition improves once they begin using the combination not only of CBD or THC, but the combination of CBD with THC, because it helps block that protein that forms in the brain that causes or leads to the dementia or the Alzheimer's and progresses over 14 years.
Then more people are talking about autism and cannabis too. And how does that work?
Excellent question. I also have a lecture, and I published a paper back in 2019 on the topic of autism and cannabis, and showing how there are different belief systems as to what causes autism. No one has agreed on this is the actual cause. There are multiple reasons why a child can have autism. But the key with the cannabis is that it helps slow down what's going on in the brain, and it allows for that bombardment that's going on a constant basis in those children to kind of slow down and prevent the outbursts and the behavioral issues, because many of these children, again, come in with medications that are antidepressants, anti-anxiety, antipsychotics, and they're either zombies or they're bouncing off the walls because they can't get those medications in sync with everything else that's going on in the child.
Thank you. And so I know you're part of MarijuanaDoctorscom. Can you explain to people kind of what that is, or the resource it is for people that's out there?
Sure. I'm the Chief Medical Officer for MarijuanaDoctorscom, as well as the one of the CMOs or medical directors for Minorities for Medical Marijuana, supporting diversity, which I know we're going to be discussing shortly. But what MarijuanaDoctors.com is a platform, an educational platform for patients, where they can go, and there's a section entitled Conditions, where you can search whatever condition you have or a family member may have, and an article or information will immediately come up with different research studies that will be or are included in the actual article. But it starts from what the disease is, what the statistics are, what's the conventional treatment, what the cannabis treatment is, how cannabis can help and why it helps, how conventional treatment works. And every one of those articles have been reviewed by me regarding the scientific component of things. So we make sure that it is as scientifically sound and as evidence-based as it can be, obviously with the, within the limitations that we have in this country. There hasn't been a lot of research done in the United States because of the fact that cannabis remains a Schedule I drug, thanks to Richard Nixon in 1970. That being said, we are limited to the amount of research that can be done. Granted, a lot of research has been done or is being done on the CBD side of things, but looking at the whole plant on humans, there isn't that much. There's studies that have been done on animals, but not much on humans in this country.
Yeah. So as we talked about this week, Hispanic Heritage Month starts. So are you planning any initiatives or the things that people can do or or websites or people you think people should be looking at to learn more about kind of cannabis in the Hispanic community?
Sure. I participate in a group called Cana Familia, which translates to Cana Family. And every Thursday, they have some type of a lecture or a lecture series where 2 or 3 providers come on board and we speak on a specific topic. And as we move into Hispanic Heritage Month, there's going to be a lot more activities going on, a lot more education happening, a lot more information for our community.
Great. And kind of talking about social equity in there, is there anything you've seen that you think people could do or support more around that, who are brands, consumers in the medical industry?
Well, the main thing is get educated on what cannabis is, because when you speak cannabis, the first image that many people get is, somebody with dreads in a tie-dye shirt smoking, a joint or sucking on a bong. They don't see my typical 5-6-year-old that was on 5 different anti-epileptic drugs, that was having 300 seizures a day, and now they're having 5 seizures a month. That's the vision that they need to get. The child that has suffered and the family members that have suffered by having a special needs child, and how the cannabis has helped this child have a better quality of life, as well as the parents.
Thank you. So what is the most surprising thing you learned? You wrote Hope and Healing, your book. So what did you learn that was kind of really surprising to you from that when you were researching?
There were many surprises.
Yeah, sure.
There were many.
Yeah.
But the main one was, and when I tell people this, they look at me and they question me. A few have called me a liar, until I open the book and show them that the United States federal government has a patent on the use of cannabis for neuromuscular disorders.
I've never heard that.
And I get that look. That's the look.
Wow.
And so you see and tangibly understand the hypocrisy that it's a Schedule I drug, which is defined as no medicinal value, highly addictive, but yet there is a US patent on the use of that illicit, illegal drug for neurological disorders.
Now, do you think, like, in the next 5 years that it will become federally legal? I know it's a hard question, but we see movements, but is it really moving forward?
There's movements that, right now there's, I don't know if you're familiar with the MORE Act,
Yep.
MORE,
Yep.
which stands for marijuana, what is it? Marijuana, I forgot what the O is, but Reinvestment Expungement Act.
Yep.
And what it does is it decriminalizes medical cannabis for medical purposes. It allows for the VA to recommend medical cannabis. It allows for reinvestment into communities that have been harmed by the war on drugs. And so a percentage, I believe 5% of the sales tax is to go and be reinvested into these communities that have been struck so hard by the use of by cannabis. And expungement, which is an expungement of criminal records for individuals that have been arrested specifically and solely for cannabis. So a lot of states have a 3 strikes you're out, and if your 3rd strike was cannabis related, eliminating that 3rd strike and or eliminating all of them and expunging their records. So it's the MORE Act that is being addressed and being discussed. I'm hopeful that it'll get enough legs behind it to be able to move forward. But again, there's so many things happening, like a pandemic, that people's heads are
structure, that
are all over the place. Every day I'm the medical director of multiple clinics, and every day we are restructuring and working with our employees, our staff, our providers, because like just today, one of my providers around 11:30 sends me a message and says, I'm feeling sick, I've got muscle aches, I've got diarrhea, I've got nausea, I've got a fever. My first question was, did you get tested for COVID yet? because that's what we live on a daily basis. And so he tested himself, he came back negative. Okay, so now let's look at all the other things that it could be. So let's check, let's get some blood work, let's do this, let's do that, and go home. So now all his patients that were scheduled for the afternoon, okay, let's restructure them, let's reschedule them, let's shift them over to other providers. And if that's what I'm dealing with in 6 clinics, imagine what our government and our government officials are dealing with at a larger scale.
And so what do you see as like the major obstacles to get more medical professionals to sort of understand the use of cannabis in treatments?
Allowing this to be taught in medical schools. Less than 10% of the medical schools discuss the endocannabinoid system and how cannabis works on the endocannabinoid system and how it can be utilized for multiple things, for multiple conditions. And until medical schools begin to educate the students on that, we're going to continue to have colleagues that go through 4 years of medical school, 3, 4, 5, 7 years of residency, go out into private practice, and a patient will come up to them and say, hey, doc, I've been considering using medical cannabis. What do you think? And they're going to go, blah, 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 blah. I don't know.
Yeah. Starts in the beginning. Yeah. Is there anything you would want us to know that you don't think gets talked about or we haven't talked about in this kind of discussion that you think is really important for people to know?
What's very important for people to know is to educate themselves, because the government hasn't educated us. They've given us lies, they've given us myths, but they haven't given us true education. Religion, churches have also not given us true education, in spite of the fact that it is a plant and it was, if you are a believer, it was created and it came to be in a garden called Garden of Eden. But without getting too biblical on people, there is a verse in the Bible, Genesis 1:29, where it talks about how all plants and seed-bearing trees are for food and for medicine. So just be mindful of that. But educating themselves, educating and finding the education from qualified places and sources. Sites such as AskGrowers.com, sites such as my personal website, dr.rosadomd.com, where you're going to get a lot of information. Going to my YouTube channel, Medical Talk with Dr. Joseph Rosado, where I have quite a few videos, both in English and in Spanish, educating on topics such as, is my child going to get high if I use medical cannabis? Or if they are on medical cannabis? Because it's interesting, parents will ask me, is my child going to get high if he uses or she uses medical cannabis? And my question to them is, do you ask your pediatrician, or did you ask your pediatrician when they prescribed speed to your child for their ADD or ADHD, if they were going to get high on that? Do you ask your doctor if your child is going to get high because they have cancer and have cancer pain and are getting morphine? Do you ask them if they're going to get high on the morphine? So why are you asking me if they're going to get high with cannabis? It's the same kind of medicine as the amphetamine that they're getting for their ADD, ADHD, and it's the same kind of medicine that they're getting like as morphine for their pain, for their cancer pain.
Well, thank you so much. We really appreciate it.
You're very welcome. Thank you for your time.